about to go on.
Wonderful.
This is 41 Today on 41 NBC.
Good morning and welcome back. Today we have Dr. Charles Teams joining us, a resident physician at Piedmont Macon Medical Center. Thank you for being here today.
Thank you very much for having me.
I'm excited to have you here because we have a really important topic, the Great American Smokeout. And so I want to talk about that. We hear a lot about lung cancer as one of the major risks of smoking, but we know that there are other health downsides as well. And so I want to talk about that. Can you talk more about those risks?
Yeah, absolutely. So over 500,000 Americans die each year from smoking-related causes of death. And it's really not just lung cancer. We know that smoking is linked to at least 10 other forms of cancer: bladder cancer, liver cancer, esophageal cancer. And then on top of that, the things we're really worried about are things like heart disease, COPD, stroke, not just things that can kill you, but things that really will negatively impact your quality of life, make it harder to get around the house, harder to be active, harder to just enjoy day-to-day life.
Right, just living. And so I want to talk about that. Is it ever too late to quit smoking? Sometimes people say they've done it for so long, why quit now? Is it worth it still?
Absolutely, absolutely. And that's the great news, is that it's really never too late. Over at Piedmont, every day I see patients who've been smoking for 15, 20, 30 years sometimes. Wow. And they very frequently say, it's too late. The damage has already been done, but that's just not true. If you look at the data, within 24 hours, if you quit smoking, your heart rate goes down, your blood pressure goes down, and within a month, most people say, hey, I feel better, I'm breathing better, you're coughing less. And then when you look at the 5-year data, if you can quit smoking for 5 years, your chances of dying from a smoking-related cause of death get cut almost in half. Wow. And if you can quit for 15 years, at 15 years, when we compare the data between people who have never smoked and people who quit smoking 15 years ago, the chances of death are basically the same. It's as if you never smoked at all, statistically. So there's great cause for hope. It's really never too late.
Right, so we want to encourage folks. Now, how should someone who wants to quit get started? Is cold turkey best, or what do you suggest?
I would say the most important thing is just to start. I know that sounds silly and simple, but whether you're quitting cold turkey, whether you're going to taper down, it doesn't make a huge difference. It's just pick a date. Pick a date and say, this is the day I'm going to have my last cigarette. And then tell somebody. Tell a friend, a family member, a loved one, your spouse, brother, sister. Tell somebody who you trust, who's going to help you, who's going to support you, who can help hold you accountable. And then tell your doctor.
Okay.
Go to your doctor and say, hey, I want to be quit by the end of the year. How can you help me get there? And they will be more than happy to help you get there. Here at Piedmont, if somebody comes to us and they say they want to quit smoking, we're overjoyed. We want to help you get there.
You're like, let's do this.
Yeah, let's get it done.
I love that. All right, now, what about vaping? Is it safer as an alternative for patients who want to quit smoking, or what are your thoughts on vaping overall?
Yeah, unfortunately, it's not something that we would recommend as an alternative to smoking. Obviously there are fewer dangerous compounds in vapes that we know of, but there are still compounds that are not safe to be breathing into the lungs, things that cause popcorn, lung disease, interstitial lung disease, things that will permanently damage the lung. And there's just not a lot of really good long-term data. Vapes haven't been on the market for long enough for us to really see how safe are they in the long term. And so it just, out of an abundance of caution, it's just not something that we recommend at this time.
Right, avoid it if possible. Now, what tools would you recommend to help someone who wants to quit smoking? What do you suggest?
I would say the most important thing you can do is talk to your doctor and ask what options are good for me. There's things like nicotine patches, nicotine gum that can help reduce cravings. But there's also medications like varenicline, medications like bupropion that can help make quitting smoking a lot simpler, a lot easier, a lot less unpleasant. Right. People feel like that's cheating, and it's not. We want to help you get to the best health that you can be in. And so whatever tools we can get you to get there, we want to give to you. There's support groups online. I'd recommend going to the CDC website or the cancer.org website. They have pages and pages of information of how to quit smoking, links to support groups, links to the podcast, online classes. Millions of people have done this. If you're trying to quit smoking, millions of people have done this before you. And I know,
now is the time.
Yeah, now is the time.
All right, if you want to find out those resources or more about the Great American Smokeout, head on over to our website, 41NBC.com.